Welcome to the final biology teacher podcast on the fetal pig dissection. It's probably one of the more difficult dissections to do, which is probably why it's good that you're watching, because if you were struggling with actually doing the dissection, or if you've ever attempted it, you know that it can be quite difficult. All right. For a couple reasons, by the way. The nervous system is the central system to all the body systems. None of them work without it. So it has the most protection, which means to dissect it, we really got to get in there and we got to dig. So luckily I've done most of the dissecting for you. We're going to take a look at it. We're going to look at the structures, talk a little bit about their functions, and then call it a day. This, of course, is our last system to dissect before we end this unit. We've done the circulatory system, the respiratory system, digestive, urinary, reproductive. So we're gonna end here, and of course the star of our show once again, ladies and gentlemen, for the last time, his farewell tour, little fetus. All right, now as you can see, little fetus has seen better days, but remember that this dissection is not in vain. Little fetus has been incredibly helpful in helping us understand the anatomy of not only the fetal pig, but also of our own human anatomy. So before we kind of wrap this up, very much thank you to the specimen, because hopefully you recognize that it's this specimen that has helped us learn this along the way. So that's really cool that we're able to do that. All right, now to start off, let's get some sort of orientation here. We are obviously looking at the dorsal view of the fetal pig. Okay, this is the back view of the fetal pig laying down. We are going to start cranially, or toward the top, superiorly for some of you. All right, and we're going to talk about the structures that we see here in the head. Now, if we look up here, I've removed the scalp, and I've actually removed the skull bone. Now, this specimen actually is full term, meaning that it was almost ready to be born at this time. What I've done here is I want to show you a couple of things in particular. This very thick membrane that is covering the brain, all right, that creates a sac. It's the meningeal covering of the skull, the meninges, so to speak. And what happens here is this is a very, very thick membrane, thicker than most of the ones that we saw on the inside of the body. And it protects the brain by letting it float in a sac of fluid, and it prevents it from hitting the skull wall. That would result in a concussion, or what we call a concussion in a human being. Now, I'm going to show you something very quickly here. I'm going to show you a piece of the skull that I removed. The skull bone is here, okay? And you can see here it's very dense bone. It's very sharp, okay? Which is why it's kind of difficult to do the dissection with, because we've got to get in there. And you also notice that this part of the brain here looks like it's just been demolished. That brain tissue is so soft and so delicate that just having been exposed for 24 hours, it's really braided down and really just doesn't hold up. Which is why I keep this other side covered with a meninges, because if we remove that meningeal sac, and I'm going to do this, try to do this very carefully, because I don't want to disturb the condition of the brain, we can clearly see the folds. Another thing that we can note is that this specimen was injected with pink latex or red latex to give us an idea of blood flow. See how much blood flow is in the brain. Okay, it's obviously a central organ, so it really needs that type of blood innervation. Now, if we look at this, the large portion of the brain, this whole section here, okay, is all the cerebellum, or it should be cerebrum. The cerebellum is inferior to that and is located here, okay, at the inferior part of the brain. The meningeal covering here, again, very, very thick, but if we try to peel it off, we can see a distinct difference in the texture of the cerebrum, which is this upper portion, and the cerebellum here. All right, so that's the parts. And of course, here we get into the entry of the spinal cord. Now, what I've done at this point is I have actually removed the dorsalmost portion of the vertebral column. So what you are seeing here is the actual spinal cord. Okay, that's that structure right there. Now, if we looked at this, what would occur is right here in this area, these nerves would start to break off in a whole bunch of different, very small neurons. This area would give us what's called the brachial plexus. That's a network of nerves that cover the entire shoulder carriage here, all of this space here, this space here on the pig. Let me zoom out so you get an idea. So the brachial plexus would innervate here, all right? And those are the nerves that are originating from this portion. Now, the brachial plexus gives sensation to all of that area. And anybody who's ever played football, maybe got hit in the chest, we call it getting your bell rung or getting a stinger. Because when we hit those nerves, all of them kind of go haywire, and that's where that nerve is. And of course, if you hit right here on your sternum, that's where that's gonna ring your bell, so to speak. Now, as we go further down, we see these large nerves coming off the side. This area here is called the cervical region of the spine, and it equates to basically the neck. Okay, but then we get into this next region here, which is the thoracic region or the chest region where the rib cage is. Now, the thoracic region has a nerve that goes in between every rib of the rib cage. Those are called intercostal nerves, or in between the spaces of the ribs. So in between each rib, there's a major spinal nerve coming off that center portion, and we can see that right there. Okay? Now, if we look very, very closely, each of these spinal nerves has sort of a thicker portion, and I didn't want to destroy the nerve. Again, this is very sensitive tissue, so too much dissection will really start to cause it to break down. If we go take a deeper look way down in here, okay, we're taking a look at the spinal cord inside the vertebral column, that the vertebral column has been removed, okay? And then what we can do here is we can see the spinal nerves coming right off. And the point at which they come off, there's a basal ganglion. And those basal ganglion, or those root ganglia, sort of are where they attach and where the direction of the nerve impulses sort of are directed. All right. If we go down further down the backbone, what I've done is I've not removed the actual spine or the actual vertebrae here, because I wanted you to see that ridge. And if you've ever felt the back of your back, you have those bumps. Well, what you're feeling is the spine of each vertebrae as we go down, and you'll notice that they're larger here and very shorter here as we go down. This area is still a thoracic region until we get to about here, and you'll notice that the overall shape of those change. Then we enter into the lumbar region, which is, so we go the thoracic region all the way to here where the vertebrae change, and then we have the lumbar region or the lower back, and then we have the sacral and the coccyx region, which is here at the tail. Keep going off the screen, I apologize. So if we zoom out, that's probably easier to do it this way. We have the cervical region or the neck region, we have the thoracic region, we have the lumbar region, and then we have the sacral region. Just like we had the brachial plexus up here, we have the lumbar or sacral plexus down here, and it's a similar nerve situation. So if we wanted to take a look at that in terms of a diagram that you might see on a lab of this nature, we can see here that there is the cerebrum, the cerebellum, okay? This is the spinal cord where it attaches to the brain itself, and then it goes all the way down. If we look at this area here, this is the brachial plexus. These are the intercostal nerves. The basal ganglion or the dorsal ganglion are right there, and then we have the sacral plexus. All of these are what we refer to as spinal nerves. Okay, all of the ones that root off the spine. These are obviously the thoracic or the cervical, thoracic, lumbar, and sacral. So cervical or neck is this region here. Thoracic, this region here. Lumbar, lower back is here. And then, of course, the sacral are all the way down there at the bottom. All right, so that is sort of the dorsal view of the nervous system of the fetal pig. Again, I kept the most of the thoracic vertebrae intact because I wanted you to see the external anatomy as it exists, and we can also see very clearly here the rib cage, and the rib cage ends here. Okay, this is the last rib that I'm pointing at, which means this is the last thoracic vertebrae. This is the first lumbar vertebrae. And in humans, you will hear people say, oh, I have a sprain of a ligament in my L4. Well, what they mean is the fourth lumbar vertebrae. So if we counted 1, 2, 3, 4, the sprain is the ligament either between L4 and L3 or L4 and L5, and usually they'll say an L3, L4 vertebrae sprain, and then that's, at least then we know what we're talking about. And of course, just a quick note, most of the body's essential functions like breathing, heart rate, and stuff, those originate in the cervical region of the spinal cord. So that's why breaking the neck can be very critical, because if the spinal cord is broken in the cervical region, the likelihood of terminal ability for your body to compose its own functions like breathing and heart rate becomes very, very serious. All right, now we can see very clearly that the brain tissue here is too soft. We would not be able to remove that in a condition where it would actually stay, kind of stay together. So what I'm going to do is I'm going to go get a human model real quick, and then we'll go over that with respect to the pig, because again, the pig's tissue, it's just next to impossible to get the brain out in one piece and still be able to see what it is. So hold that thought. If we were looking at the brain, and this is only half of a brain, okay, a couple of things that we would note. This whole thing here is the cerebrum, okay? This back part here, which got left in the model because my brain's falling apart. Sorry. I thought I was prepared. All right, so put my brain back together. So this back part here would be the cerebellum. Let me go ahead and put up a better model of this view here. There we go. And then, of course, if we looked at this in the pig, the spinal cord would be right here. There are some structures that we really can't see very well in this model. In the fetal pig, if we were to do a complete opening, the olfactory bulbs would be right here where my finger is moving, right? And of course, the eyes would be right here, right? So that's where, just to give you some perspective on where this whole thing is. The line that goes down the half of the brain, keeping in mind this is two, this would be the cerebral fissure or the central fissure. And the fissure is referred to as a, kind of a split, so to speak. All right, so that's what we would see, and again, the cerebellum is there. I think if we look at it from this perspective, though, we might be able to get a little more insight into what we're actually seeing. Uh-oh, went away. So let's take a look at a lateral view of the brain. Okay, now this structure that you see here, and it's kind of missing here, it's the connecting piece, so to speak, would be the olfactory bulb. So this is going to the olfactory bulb. But this central piece here is right here. See that little pot? That's the adhesion point where the two halves of the brain hold on. And of course, this whole thing is the cerebrum, all right, the larger portion of the brain. This is a cross section of the cerebellum. This is the brain stem, and then this is the spinal cord. Okay, the structure located here, this little bulbous structure, is the pituitary gland. Okay, and this right here is the optic chiasma, and that's where the optic nerve is going to innervate into the brain. I'm trying to think of something else that you. This is the corpus callosum, often called the tree of life. It's kind of the center part of the brain, and we can take the brain apart and really get the center body, the corpus callosum. So this is kind of the outer part of it. This is the inner part of it, and we can kind of see how the brain sort of works and what the brain tissue would look like. Okay, so if we take a look at that, again, this is a human brain, so it's not exactly how we would expect it, because of course in the pig it's kind of like that, but the brain sort of squeezes up like that, so it's not exactly the same shape, but we get the idea, hopefully. All right, this is gonna sound weird coming from a biology teacher. The brain and the spinal cord and the nervous system together is kind of the frontier of medicine and the frontier of anatomy. We kind of get it, but it's kind of the harder part because we don't understand completely how it functions. We've got a good idea, and we certainly aren't in the dark ages, but when it comes to a comparison of how we understand the other body systems, this one is not quite as solid as the other ones, okay? So I'm going to go ahead and bring Leo Fetus back for his final bow, and we're going to go over the major anatomy of the fetal pig nervous system. All right, here we go. By the way, did you know that it used to be thought that eating pig's brains made you smarter? Of course, it was eaten by dumb people, and it didn't work. So, no, seriously. But in the South, brain and eggs is actually pork or cow brains scrambled with eggs is actually considered in some places a delicacy, especially in the deep South. And in Indian cultures, that's Asian Indian cultures, monkey's brains are considered a delicacy. So they're eaten. It's kind of gross, I know. All right, here we go. So if we take a look here, this whole structure is the cerebrum, okay? So use my probe instead of my big fat finger. All right, so this is the cerebrum. This structure here at the very dorsal part is the cerebellum. This is the spinal cord. This is an intercostal nerve. Let me get it open so you can see it. That's the intercostal. My big fat finger's getting away. All right, sorry. The intercostal nerve, okay, and at the base of the intercostal nerve, we have that dorsal ganglion where it sort of attaches. All right, and then if we look at the pig from a broader standpoint, we can show that this area here, and I've actually cut off all the cervical vertebrae and the first two thoracic vertebrae. So the cervical vertebrae are all missing. So this is the cervical region. Then this here, from here to here, are the thoracic vertebrae, or the thoracic region. Then we have the lumbar region that goes down to about here. And once the spine starts to take that downward curve, which is going to be about right here, we're going to get, right here, then we get into the sacral vertebrae, okay? And that is the overall view of the fetal pig. Now, I hope this has helped, all right? And before I wrap up this section, let me share with you a couple things. What's the point of doing a fetal pig dissection in the first place? We probably should have talked about this during the first dissection. First off, understanding mammalian anatomy helps us understand our own bodies, and hopefully it's accomplished that for you. The other thing is people are going to get sick, which means that we're always going to need medical professionals to be there to help us. So hopefully if you've experienced this and this is something that intrigues you and you want to learn more about it, maybe, just maybe, being in the medical profession is something for you. It's something to think about, all right? So if this is something that helps you, and once again, little fetus here has been a trooper. He's really helped us out. And it's by understanding that we can use specimens like this to really get a deeper understanding of not only how organisms work, but how we work as an individual and as a person and as a species. Then lots of things can change. So good comes out of it, even though maybe some of you are a little squeamish at first. Okay? So that's going to wrap it up for us. I hope your understanding of the mammalian systems is outstanding, and if not, you can always ask questions, email me or whatever. And until then, I have no pun about the brain. I have no funny joke. So I'm going to go ahead and say insert your own joke here, and have a great day.